Good afternoon. Welcome to this afternoon's briefing. A couple things that I'd like to announce this afternoon. First of all, is just a reinforcement of our continued community embracing of the shelter in place and keeping our social distancing in mind, especially with the holiday weekend coming up. We would implore the public to continue to be vigilant, continue to practice the safe distancing that we've been talking about so we can get on the other side of this situation as quickly as possible. I have an announcement on behalf of the folks that have been working on the housing piece of this whole situation. They just asked me to make the announcement today so people know that the work is in progress. I don't have a lot of the answers to the particulars this afternoon, so they're going to have an announcement at a different time so you guys can ask them specifics, but just so the public knows that this plan is coming together. In working through the population level issues created by the COVID-19 crisis, the Emergency Operations Center identified the need to create a housing branch. This cross-sector includes city and county government, the health department, OSF Healthcare, Unity Point Methodist, the Convention Visitors Bureau, the Home for All Continuum of Care, and Heartland Health Services. The team crafted a hotel solution in partnership with 4 Point Sheraton to house 3 separate populations. Number 1, individuals who are symptomatic and require isolation but are unable to isolate properly in their existing accommodations, for example, in a shelter. Number 2 are individuals who need to be quarantined because they're asymptomatic but have been exposed. And the third are individuals who reside in congregate living situations such as shelters and are high risk for negative outcomes from COVID-19. Proactive placement of these individuals in hotels help to reduce their risk, increase the ability for social distancing within shelters, and also reduce the strain on the healthcare system, which has been our first and foremost goal throughout this whole exercise. The housing branch has worked through the logistics of hospital discharge and necessities for individuals utilizing the housing solution called the COVID Recovery and Secondary Housing Plan. The plan has been approved by FEMA for reimbursement of costs, and the county has agreed to front the initial costs associated with the program. The Continuum of Care has also received funding through the Illinois Department of Human Services to help house individuals experiencing homelessness that need to use the plan. Those who are able to utilize the hotel will be referred by the hospitals or the Continuum of Care at 4 Points. So people won't just be able to walk in and admit themselves. So there will be a process for this, and the details will be coming out shortly. We're expecting to have this in place, I'm told, at the latest by the first of the week. Potentially sooner, it's just hard to say. So that's all the announcements I have for this afternoon. Now, Monica Hendrickson.
Good afternoon. The to-date totals for April 9th are as follows. The Tri-County region remains at 39 cases to date. Peoria County is reporting 16, Tazewell County reporting 16, and Woodford County reporting 7. The total number of deaths to date remain at 3. The hospital systems of OSF St. Francis Medical Center, Unity Point Health Methodist, Pekin, and Proctor report 19 ICU beds in use for individuals with either confirmed COVID or persons under investigation for COVID. In addition, they are reporting 29 non-ICU beds in use for those confirmed or under investigation for COVID-19. Since Peoria County remains at 16 confirmed cases, 8 are still in recovery, 5 are at home self-isolating, and 2 are hospitalized. In regards to demographic, we still sit at 50% female, 50% male, and 56% of confirmed cases are under the age of 60. As we enter into the weekend, beginning with Good Friday tomorrow, it is important to stress the importance of continuing to stay at home and distancing. I know many people plan to travel this weekend to join others in fellowship. And in fact, my husband actually commented today that this is the first Easter weekend in 37 years that he will not be spending with his parents. But staying at home and social distancing are key to stopping this virus. The CDC's Emerging Infectious Disease Program just issued new research from Los Alamos National Laboratory. The initial thought was that the reproductive number, or the number of people an individual could infect, was approximately 2. So for example, if I was infectious, I would be most likely spreading it to 2 other people. However, new data and modeling suggests that the number is closer to 6. So think about that. One person can impact 6 people. And based on comorbidities that range from diabetes, asthma, COPD, hypertension and heart disease, lung disease, renal disease, just to name a few, those 6 people are going to be very much impacted. To discuss this more, I'd like to introduce Dr. Sater from UniPoint Health.
Good afternoon, everybody. The stay at home and stay in place order has actually affected us in a positive fashion. The number of cases that we had expected originally when this first started compared to what we're seeing now, it is decreased, and the time to where the peak number of cases has been pushed out. So the effect of what the governor and what the federal government have instituted has actually worked, and the risk of our healthcare systems being overwhelmed is lower today than it was 3 weeks ago, and that was the goal. The holidays are coming, and I'm in the same place as Monica's husband. I won't be with my dad, and I regret that, and I wish it was different, but it is what it has to be done. My dad would be one of those persons at risk, so I will not put his life at risk. And my kids don't want to put their grandparents' life at risk either, and they understand it. So I have teenage kids, and that's the way it is, and it's hard, but we all understand what we're doing. I was also asked to discuss a little bit what does surge mean in a hospital setting. The surge is in case that we do have a big wave of patients that come in, how does the hospitals respond? So we are all preparing OSF and UnityPoint, and to give you an idea, UnityPoint usually can have 250 beds available, and we can go up to 430 if we had a large number of patients come in. OSF can do very similar. They can increase from their original 500 or so beds to close to 800, 900. And our intensive care unit beds, which are critical for this illness, we can go from 35 or 36 up to near 90 ICU beds. So we are ready in case that this occurs. We've curtailed our surgeries and outpatient procedures to be ready for this. And we feel that we're getting to the point where we're prepared and really hoping that this never really occurs, but being ready if it occurs. We got to be able to take care of our neighbors and community members. And with that, I'll give it back to Monica.
Thank you, Dr. Sater. With that, we'll open it up to questions.
So the governor said today in his address that there may be some early signs that we are succeeding, in fact, at flattening or bending the curve. And today we had no new cases announced. Do we think the social distancing measures that have been in effect now for a few weeks are making an impact here locally?
I think so. The question being, do we believe that we've flattened the curve or at least made it less steep? And what the governor mentioned is that we're not seeing an exponential increase in the number of cases. Now recognize the fact, though, that our current cases that we see today are ones that were exposed to the virus anywhere up to 2 weeks prior. So it could be the day before or 14 days before. And so with that in mind, we're always going to see kind of that delay. So while we are seeing the initial signs, and Dr. Sater mentioned as well, that we're not at that peak, and our peak is maybe shifting over and flattening down, it's not a reason to take off these policies or remove these restrictions. In fact, it is another demonstration of why they are working. Because as we have only actually been, I think this Saturday will mark our 2 weeks officially in our stay-at-home policy from a governor's order, we want to make sure that we are extending this as much as we can.
Monica, can you share the percentage of, sorry,
No, you're good. I know, it's hard to get.
could you share the percentage of ICU beds that are, I know you shared the number, but can you share the percentage for the local area?
So the number of ICU beds that are currently used for COVID or persons under investigation sits at 19, and that is approximately about 7% of current bed usage for ICUs. Now, again, that's not to mention that there are ICU beds that are used for other illnesses, but those that are currently being utilized in our region for persons under investigation or COVID positive is sitting at 19.
So with the projected peak, it was supposed to be next week around the 17th, and you guys have both mentioned, pushing it out. What would be the new peak then?
It's really hard to say, and the question is, when is the new peak for this? And the best example that I've heard about it is there's 2 thoughts in the modeling process. There's one that's a very severe model, and there's one that's much more, I think, a happier model, let's just say. But it's really hard to have a middle model, and the reason why is that think of it as that you are on a fine line, and at any given time that we either relax or make more aggressive policies, we shift from one side of it to another. So really, every day that we continue social distancing, and every day we put in this limitations, is a day that we're extending this out further to the point where our peak might not be that extreme peak that we thought of when we first entered this virus, but more of a kind of steady plateau for a while. Because again, we talk about the peak, but the peak doesn't mean that the next day after we meet it, that the virus disappears. People will still get ill from this virus, regardless of whether or not it's past the peak. The issue is that our healthcare providers and their capacity is going to be at a level where they can handle that care and those numbers in a way that people are getting the care they need.
So pushing the peak out is almost a good thing. It sounds like people hear peak and they think, oh, we want it to be close, but pushing it out is actually helpful for you guys.
Exactly. I think pushing out the peak and kind of flattening and making it steady allows our healthcare capacity to be on top of their game, so to speak. So they don't have to make those difficult decisions that you're hearing about in New York and in Italy and other communities, where anyone that's coming to seek care is going to get the high standard of care that they deserve.
Because of what's happening now, would you say that the way we operate as a community after the virus is under control would change significantly? For instance, do you think that people should stop shaking hands in general? Should people consistently give others 6 feet of distance?
So the question is, after we've kind of gone through this process, will we have a change? And I think a lot of times people like the term recovery, and I think recovery means that you kind of come back to a certain baseline. It's really about resilience in terms of how do you plan, how do you maybe change operationally. I know at the health department, we're already talking about the fact that when we are back to operations, what does that look like? Do we take some of our chairs out of our waiting rooms to spread them out more so? Do we limit the number of appointments in a certain hour block? All of those things are going to become considerations that not only the health department, but other employers and individuals will be making on a day-to-day basis.
So now that we are starting to see a little bit of the impacts of social distancing taking effect in terms of the numbers of cases, I mean, is there a concern that with the Easter weekend there are going to be just those people who throw caution to the wind and say, I'm going to travel, this is what I've always done, and we might see a relapse, so to speak, or you think people are taking this seriously?
So the question is, with the information that the governor gave out today, as well as an upcoming weekend where a lot of people do travel and get together, will we see possibly another peak later on? And what was a good example is what we actually did see in China, where individuals started alleviating or not necessarily holding on to that policies and restrictions in a way where they did see another peak right afterwards. And so again, it's going to be really important that while we are in the improvement area and we've been successful, and that's a great thing that Illinois can be proud of, let's not take our good work and just throw it away, but rather continue it so that we are on that pace to really have a healthier community that everyone can access our healthcare system equitably.
So we're encouraging people don't travel this weekend. Like, even if that means, you know, you can't follow those family traditions that you've cherished for, you know, so many years. Just, it's better to stay in place and find another way to recognize the occasion.
So the question being, you know, with this upcoming weekend, would we recommend people to travel or stay at home? The governor's order still exists. You want to stay at home. Don't go out for any non-essential needs. Really, there are lots of our faith-based agency organizations are doing a great job connecting with social media and creating other mechanisms to have that fellowship during this time of year. And so definitely take advantage of that. And remember, I think Dr. Sater said as well, this is really to protect those around you. And remember, it's not just 2 people now. We're really talking about 6 people that might get infected. And so really holding on to those policies and continuing them.
You say things are getting better right now. Is this a time to be comfortable or a time for us to buckle down? People may begin to be lax. People may begin to not practice what you all have preached for the past month or so. What do you have to say to viewers?
So for those individuals who think that this positive is a way to maybe start relaxing their practices, again, we are able to say this comfortably today because we were adhering to it for the past few weeks. And so just imagine if we continue to do this, how much better we all will be in the days to come. So again, while this is an improvement, it's showing that what we have put into place is working, but we're not out of the storm yet.
When we talk about recovery, there's a lot of debate on the national stage for sure in terms of certain drugs that even the president has, you know, promoted with some controversy. Can we talk about what the hospitals locally here are doing? I'm not sure if Dr. Sater could speak to that.
Dr. Sater would actually be great at this.
You know, what kind of, I know we often say that for a lot of people there's not much we can do, but can you talk about kind of different recovery aspects?
So there are still no specific treatments for the virus itself. The hydroxychloroquine that people hear a lot about, or the azithromycin in combination with it, they do have side effects. People are trying them. I can tell you that it has been prescribed in our hospital, but these are treatments that are not 100% proven. But if somebody's doing poorly, they may be prescribed, and we let our infectious disease specialist actually decide on what treatments they pick for each patient. There are other experimental treatments, including antivirals, that are being tried. And this is part of actual real medicine, and it does happen with other illnesses. And we are part of trying to become part of certain research trials like those antibodies where you collect the blood from people who recovered. So we're in the process of applying for that.
Would you happen to know if there's a shortage of hydroxychloroquine? Because this is something that's spoken about a lot, and people hear it, they
Yeah.
don't get it, and they may not actually need it, nor may it be helpful for them. And this is something that people who have lupus or arthritis use. Do you think this is
Correct.
going to be a problem here in our area?
I am not aware of shortages for hydroxychloroquine, and most of the courses tend to be short courses, so just a few days. I really can't tell you that we have enough evidence to be all in for any of the treatments. We do let physicians make their own decisions when they're treating their patients, and we have not restricted that part in the sense that our infectious disease doctors, if they feel it could potentially be helpful, they are prescribing it.
In terms of recovery time, what are you seeing in Unity Point in terms of how long someone may be in the ICU for, like 48 hours,
Yeah,
72?
that's where the peak becomes critical. It's not only the fact that the patients get ill and go to the ICU, but when they end up intubated, those patients tend to stay intubated for a long time. To give you an example, the average length of stay in the critical care unit tends to be between 3 and 5 days. We have a couple of people potentially who have been there for a couple of weeks. If you look at what happens in New York or in Chicago, somebody gets intubated and they're in the intensive care unit for 2 weeks. It doesn't take too many patients coming into your hospital, ending up in the intensive care unit intubated, to take up a lot of ventilators for a long time. So if you had heart surgery and you used the ventilator for a day or two and you get extubated, that's one thing. You have a severe pneumonia from any cause, but especially with the COVID-19, you may be intubated for 10 days or 2 weeks.
I have a question for either one of you. Are you guys still optimistic about the head towards the peak?
I would say so. If you asked me this 2.5 weeks ago, I probably would have said, ooh, it's a little scary. I'm not so scared right now. I think potentially all the non-pharmacological approaches that Monica has spoken about from day one are probably making a difference to where we can handle it. Again, we're lucky as in Central Illinois. We have 2 great healthcare systems with significant capacity. So we're hoping that we don't have to cross that bridge as other communities in our country and in the world have. Thank you.
So to continue to highlight National Public Health Week, today's theme is environmental health. And in fact, that the air we breathe, the water we drink, and the food we eat, and the conditions of our homes affect the health of ourselves and our community as a whole. During this pandemic, we have become keenly aware of how seriousness of this virus impacts respiratory health. Exposure to air pollution worsens respiratory conditions such as asthma. Like so many other health threats, climate change disproportionately affects our already vulnerable populations, such as the elderly, young children, people living in poverty, and people with chronic diseases, those same diseases that are those comorbidities we speak about in terms of this virus. These communities are disproportionately bear the brunt of environmental issues. That is why the recent Edwards settlement focused on communities of concern where pollution and disinvestment created higher rates of asthma, COPD, and other respiratory issues. That is why when a virus like this appears in those very same neighborhoods, they become disproportionately impacted. How can we help? By supporting public health in terms of monitoring, preparing, and responding to the health effects related to climate change. Every dollar that is spent nationally and within the state level on environmental health programs saves $71 in asthma-related expenditures. That's a 1 to 71 ratio. In addition, the Peoria City County Health Department works with HUD funding to prevent childhood lead poisoning prevention, Illinois Tobacco-Free Communities Grant to decrease lung cancer and promote healthy neighborhoods and parks, and IEMA funding for radon mitigation. All of this is done in hopes of creating that healthy and thriving community. Thank you all. We will not be having a briefing tomorrow or this weekend unless something drastically changes. Otherwise, have a good long weekend. Thank you.